So before we start, you have to ask, what is preventive medicine? Because what we're talking about, bioidentical hormones or anything that adds quality to our life, doesn't just treat an acute disease, is preventative. So what actually is that? Well, we as allopathic physicians have been trained mainly in not preventive disease, but more focusing on disease, not health. Meaning, you have a problem, let me see, what is the disease? What treatment am I going to do? Not, here's a person who's coming to me, how can I help them maintain a quality of life before they get to a disease state? So really, it's more proactive as opposed to being reactive. And there's a big difference. So what are hormones? Hormones are your body's messengers. They work together. There's not just one hormone that's off by itself without any effect on another. It's actually quite intricate. It goes from the brain to the glands, say the thyroid, to the ovaries, to the testicles, to the adrenal glands, the glands to the cells, and then there's feedback from the cells up to the brain. And that is how that works. And how we talk about it is there's a lock and key model, meaning many of the hormones are actually not free and out in the bloodstream, but they're actually on these glands. So there is what we call a lock or a receptor, and this is where the actual hormone binds. To be effective and able to be used in the body, it needs to be released in some way to allow it to be usable.